Tēnā koutou katoa. Good afternoon. There is quite a bit to cover in today's update. I want to start with the latest on our work to identify the source of our outbreak. After Dr. Bloomfield gives us the latest on our current cases, I'll then share some of the work we're doing to accelerate our vaccination program. That includes ensuring that more New Zealanders are vaccinated generally, but especially those who are currently at most risk from the virus. I'll then finish up with an update on Afghanistan. Let's start with the investigation into how these cases came into our community. Yesterday, we confirmed we are dealing with the infectious Delta variant and that it came from Australia via the New South Wales outbreak. I can now report from the whole genome sequence analysis that our current positive cases are a close match to a recent returnee from Sydney who arrived on a managed red zone flight on August 7th, had a day 1 test on the 8th, returning a positive result on the 9th. They were transferred from the Crown Plaza to the Jet Park quarantine facility that same day. This person subsequently became unwell and was moved to Middlemore Hospital on the 16th of August. What this information tells us is that our cases are most likely to have come from the traveller. This is a significant development. It means now we can be fairly certain how and when the virus entered the country, and that based on timelines, there are minimal, possibly only 1 or maybe 2 missing links between this returnee and cases in our current outbreak. And the period in which cases were in the community is relatively short. There is still a chance that additional information could emerge to change this conclusion. So we do need to remain open to other possibilities. That means you will see our public health unit continue to be very cautious around possible places of interest. And you will have seen that in some of those locations of interest to date. However, the balance of evidence now gives us enough confidence to focus our search for that missing link. Our primary lines of investigation are staff at the Crown Plaza Managed Isolation Facility where the returnee was originally based, staff at the Jet Park Quarantine Facility, and other MIQ and border staff involved in their arrival and transport from the airport and between managed isolation facilities. Middlemore Hospital is not a line of investigation at this stage, as the individual was only moved there on the 16th, 1 day before lockdown and days after symptom onset in a number of our other cases. So let's break down the possible points where contact with this traveller may have occurred. On the 9th of August, when the case returned a positive result, our public health unit kicked into gear, contacted Auckland Airport and Customs, who went through all the footage to determine any contact that positive case may have had with staff. This is our usual practice when we have a positive case in a facility. 3 areas of interest were identified. Customs confirmed with me again today that these have all been investigated and staff tested. Nothing has eventuated from this line of inquiry to date. Let's then turn to our facilities. There were 208 staff who worked at the Crown Plaza while the individual in question was there. Of those, as of today, only 1 of those 208 staff is now overdue for testing, and only by less than 48 hours. For the Jet Park, there were 200 staff working across the site from the 9th to the 16th of August. As of today, 2 are overdue tests, but again, by less than 48 hours as of today. All staff across both sites who have not been tested in the last 48 hours are now being retested. In terms of vaccinations, across both sites, 407 people were compliant with the vaccination order that we have in place. That order requires all existing staff to be fully vaccinated. If a new staff member comes on board, they must have their first dose and complete their second dose within a 35-day window. Only 4 had 1 dose and were not yet due for their second. 1 person had gone longer than 35 days, and that person has been told they cannot enter the facility until they comply with the order. All remaining were fully vaccinated. As you can see, the compliance generally across these sites has been really high, but we will continue our search in a thorough way across both sites, as you would expect. And we'll look to come back to you with detail on those additional tests we're running across both sites in future updates as those results come through. A final point. We have learned today that a family adjacent to the case at the Crown Plaza has now tested positive for COVID on their day 12 test. While we're awaiting genome sequencing, we can assume that means we're dealing with a high level of infectivity in this case. Everyone at the Crown Plaza will stay on while we undertake our usual protocols. But here is where our practice of what we call cohorting is really helpful. People generally arrive at the same time and stay for the same period in the facility. It really does reduce down the risks and means that we catch situations exactly like this one. So while today you will see we continue to find cases downstream, there could be relatively few cases upstream, as in people who picked up the virus from the very beginning of the chain. That's simply because it wasn't here for long, we believe, before it was found. On that note, can I thank again our first positive case that was identified on Tuesday. If it wasn't for you getting tested when you did, this could be a much, much more difficult situation. Having said that, I know we're all prepared for cases to get worse before they get better. That is always the pattern in these outbreaks. But today we believe we have uncovered the piece of the puzzle we were looking for, and that means our ability to circle the virus, lock it down, and stamp it out generally has greatly improved. I'll now pass to Dr. Bloomfield to go over today's case numbers.
Thank you, Prime Minister. Kia ora koutou katoa. So today I can report there are 11 new positive cases of COVID-19 in the community. That is since yesterday's 1 p.m. update, taking our total number of community cases all in Auckland to 21. All of these cases who are in the community are being transferred safely to the Auckland quarantine facility or are already there under the usual strict infection prevention and control procedures. 12 of the 21 cases have already been confirmed as being part of the same Auckland cluster, and a further 8 are currently being investigated and are as yet not formally linked. However, for a number of those, there are strong leads to them being linked to existing cases. One of those previously reported cases of the 21 is confirmed to be unlikely to be linked to the cluster, and that is the aircrew member you have heard me talk about in this morning's media round. So this is essentially a border-related case, probably coincidental, and that case was identified during routine surveillance testing. It's an international crew member. So whilst we don't have the details on the new community cases available at this stage, and interviews are underway, we will release further information as it becomes available through the afternoon. Now, these new community cases are not unexpected, as the Prime Minister said, and we would expect the number of cases to continue to grow, in particular because of the large number of locations of interest and the mobility of these cases over the few days before the lockdown started. There are also 8 new cases in recent returnees in our managed isolation facilities. 2 of those are historical cases, and the information about those will be in the Ministry's press release. Now, 2 of our community cases were taken to North Shore Hospital overnight. One had worsening symptoms from their COVID, and the other is symptomatic and has underlying conditions. One of these people is in their 20s, the other is in their 40s. Both are in a stable condition. The Prime Minister mentioned the Crown Plaza, and as a precautionary measure, a hold was put on some departures from the Crown Plaza last night, and that was in response to this bubble of 3 people in the facility testing positive for COVID-19 at day 12 of their stay. This is something we do where we get an unexpected day 12 positive result to just make sure that there's no potential that others may have been infected after they returned a negative day 12 test. So the returnees who are on the same floor who were scheduled to leave overnight are required to stay there while it's investigated further, and that has included already reviewing of CCTV footage and running the whole genome sequencing on these 3 new cases. That is due later today, and that will help us to confirm the probable link to the case in the room next door. This is, of course, disruptive for those who had planned to leave or were planning to leave, and they'll be provided with full support. Unless there are specific issues identified that might be cause for concern, it's likely returnees on other floors who are scheduled to leave today will be able to do so. The overall assessment is that for further transmission, based on what we know so far, is there's a low risk, but naturally we're not taking any chances. We've now received the results of wastewater collected on Monday and Tuesday this week. The sampling collected on Monday returned positive results for wastewater from 3 Auckland sites: Rosedale on Auckland's North Shore and the Western and Eastern interceptors. Sampling from Tuesday at the St George site in Auckland, and that's a sub-catchment of the Western interceptor, and that collects wastewater from the Waitakere area, was also positive. This follows negative results from these locations from samples on the 11th of August. I had one of my team just quickly map out the locations of the cases and how those sit with respect to those, the drainage areas for those different interceptors, and there are cases in all those areas that we know about now. So this shows given we've only got the 21 cases so far, the sensitivity of the testing is very high, and it does help us with our assessment of the situation. There will be further results available late today for some other samples taken around the Auckland region, and additional results expected tomorrow, including results of samples taken in several locations in Coromandel and Thames. Other sampling undertaken on Monday and Tuesday at Mount Maunganui, Tauranga, Hamilton, Rotorua, Gisborne, Taupo, New Plymouth, Napier, Porirua, Hutt Valley, Wellington, Nelson, Christchurch, Queenstown and Invercargill have all come back negative. On testing, in Auckland, all community testing centres are again open today with extended hours through to 8 p.m. There are 4 additional pop-up community testing centres open, and a further pop-up centre in East Auckland has been stood up this afternoon. I'm also aware that there is some additional pop-up testing going into Avondale College for students to be able to go through there and be tested in a safe way. There is increased testing capacity in Waikato with a range of testing sites already in place, and pop-up testing sites remain open in Coromandel Township, Thames and Hamilton, and there was an excellent response from people in Coromandel yesterday with very high number of people tested. DHBs right around the motu are ensuring there is good access to testing. We need anyone with symptoms right around the country to get tested to help inform our advice to the government about alert levels. Yesterday there were close to 16,000 swabs taken across Auckland, the busiest day in that area since August last year. Around 10,000 of those tests were taken in general practice and urgent care clinics, and I want to thank our colleagues working in those settings who have really been very busy over this last day, their busiest day ever. Nearly 3,000 swabs taken across Waikato, and about 600 of those were from the Thames Coromandel area, a massive effort, and thank you very much. And I want to thank those who are for their testing and waiting for testing for their patients. Please be kind to the staff there who are working as fast as they can. We will have more confidence in the advice we can provide the government around alert levels if we have good testing rates. So if you have symptoms, please get tested. There's a lot of contact tracing work happening across Auckland and the Coromandel, and that involves the Auckland Regional Public Health Service, our National Investigation and Tracing Centre, and all of the country's public health units. Isolation by close contacts when in alert level 4 requires them to isolate separate from other household members, so it's not isolating within the household bubble. As of this morning, more than 360 individual contacts have been identified. This does exclude at this stage contacts from large settings like Avondale College and the Central Auckland Church of Christ, where there's still an assessment underway. So through the day today, that number will increase significantly. Now, details of additional locations of interest continue to be added to the Ministry's website this morning. We're also going to put out regular through-the-day updates on newly emergent sites of interest, locations of interest through our various social media channels to make sure that it's easy for people to see just which are the new ones. And it's very important that people look at the times as well as the place, because it doesn't mean if you had been at those places at any time. Please look at the time there. If people have been at a location of interest, remember the form is to isolate if you are not already. In other words, if you're not an essential worker, it does mean if you can't go out to the supermarket, pharmacy or anywhere else while you're doing that, while you're isolating, call Healthline for advice. Busiest day for Healthline yesterday since April last year, and a record number of people accessing the Ministry of Health website, almost 1.3 million, largely looking for locations of interest. On that, just a reminder, there is a Section 70 notice in place which requires everybody who has been at a location of interest to legally follow public health instructions to isolate and be tested. There is a separate Section 70 notice that applies to the household contacts of a person who has been at a location of interest. Under that Section 70 notice, and this is a new thing, they are required to isolate as well, and this means they can't go out for any purpose, or if they're an essential worker, they need to isolate until that person who's been at a location of interest has returned a negative test after day 5. We are also receiving a large number of complaints about enforcement, particularly about people holding gatherings, and these are all being referred to police to follow up. Finally, it is a time of uncertainty, and so quite normal for people to be anxious. Please do keep an eye on each other. Last year, we crushed the curve by looking out for each other. Don't forget the smallest and largest question you can ask someone is, are you okay? Back to you, Prime Minister.
Thank you, Dr. Bloomfield. As you can see from that update, level 4 is where New Zealand needs to be at the moment. But as we talked about yesterday, we do want to ensure we don't waste any time in vaccinating Kiwis. I want to start by thanking New Zealanders for continuing to take up the invitation to book their vaccinations and remind everyone over the age of 40 that you don't actually need to wait for an invitation. You can go to the website or ring the 0800 number now to book yourself in. Yesterday was a record day for bookmyvaccine.nz, with 195,537 bookings made in a single day, which is fantastic. During yesterday's stand-up, the 1 p.m. update, more than 7,500 people per minute were using the site, and it performed exceptionally well. As signalled yesterday, a phased approach to reopening vaccination sites with the level 4 protocols in place has now begun. This enables everyone to stay safe while we vaccinate. So please, if you have a booking and you have not had any other communication from your provider, please still go, because we're expecting you. Primary care facilities have also resumed carrying out COVID-19 vaccinations today, and with some less urgent appointments being cancelled as a result of level 4, many now have extra capacity. Our plan is to use that extra capacity to continue with those who are already booked in, but to also bring through essential workers. Our plans to vaccinate these workers starts with those who are customer-facing, who interact with the public as part of their essential work. For example, supermarket workers who may not have been eligible because of their age bands to date. We're working with employers of these essential workforces to identify the individuals, and workers you can expect to hear from your employer with extra details. We're also working with the COVID Vaccination Healthline on a process for smaller businesses and people who are self-employed to enable them to book if they too fit that criteria. On that note, I also want to assure New Zealanders that our vaccine supply chain continues to operate well, with the deliveries continuing to go out daily. But again, please do book. It just means that we can ensure good physical distancing when you attend your vaccination appointment. As you know, it's imperative that we get as many people as possible vaccinated. When we make a decision on who is eligible, though, our number one priority is the medical advice of our experts. You'll remember that in June, our regulator, MedSafe, granted provisional approval for the Pfizer vaccine to be given to 12 to 15-year-olds in New Zealand. Similar decisions have been made by other regulators in Europe, the US, Canada, and Japan. The advice was then considered by an additional group of experts who also supported an extension of eligibility to young people. On that basis, Cabinet has agreed to make the Pfizer vaccine available for 12 to 15-year-olds. This is not a decision we have taken lightly. Many of us are parents ourselves and take this duty of making decisions about other people's children extremely seriously. But it is safe and it's the right thing to do. So 12 to 15-year-olds can become eligible and book along with everyone else that we are opening up to from the 1st of September. We know, though, that a number of these children's parents will already be eligible to book their vaccines. We want to be practical about this. So from tomorrow morning, parents and caregivers who are eligible for their vaccines will also be able to book their 12 to 15-year-olds at the same time. But if you've already booked, then just bring them along. Please just make sure that while you do that, you work hard to keep physical distancing up from others. There are an estimated 265,000 people in the 12 to 15-year-old age bracket, so this is an important next step. And please be assured again, we have more than enough Pfizer vaccines for everyone, including the 12 to 15-year-old age group. As COVID takes centre stage in New Zealand, international events and obligations remain, none more so than our responsibility to New Zealanders and those who help New Zealand and Afghanistan. Earlier today, we deployed a C-130 Hercules and supporting personnel to assist with international efforts to evacuate New Zealanders, Afghani nationals and other foreign nationals from Afghanistan. The New Zealand Defence Force is preparing to deploy for up to a month, and due to the developing situation in Afghanistan, sought approval from Cabinet to deploy up to 80 personnel to support the international response. The contingent will include aircrew and maintenance staff, a medical team to support our personnel and evacuees, operational support staff, logistics personnel, and force protection, among others. All NZDF deploying personnel are vaccinated and will be carrying out COVID-19 prevention protocols. They will complete 14 days managed isolation on their return to New Zealand. We will continue to work alongside partners, especially Australia, as we respond to this rapidly evolving humanitarian situation. This means that we may see some individuals bound for New Zealand returned on partners' assets and vice versa, as our international partners look to cooperate wherever they can to safely expedite the evacuation of those most in need. When we met this morning with officials, we were advised, though, that the situation on the ground is incredibly difficult. People are struggling to get to Kabul airport. We need to be prepared for how hard this mission will be and how difficult it will be to evacuate those who we are seeking to help. Our thoughts are with our Defence Force team as they enter on this deployment. I know that you will do what you can. Before I conclude, some final public service announcements back related to our level 4 settings. First, we're being asked to remind businesses who are wanting advice or to know what support might be available to them that they can call the EMA's business helpline on 0800 500 362. Of course, MB also provides support through Business Connect. Second, ministers have made a decision to extend the period for air travel from Queenstown and the Cook Strait Ferry for 24 hours through to 23:59 on Friday, 20 August. This applies only to people needing to return home and is in response to the large amount of demand that we have on those facilities. Lastly, I know everyone outside Auckland and the Coromandel in particular is anxiously awaiting news on how long their level 4 conditions will remain in place. Ministers will meet tomorrow morning and will share a decision taken at tomorrow's update. What I'd like to leave with you with today, though, is some optimism, but also a strong serving of caution, as you'd expect. News that we believe we've identified how this Delta variant entered New Zealand should not be underestimated. It means that alongside the what, we now believe we have a good handle on the how and where. That said, it is well known globally that Delta is tougher than previous variants of COVID. So while we have further information to inform our response, we also know it is going to be a tough fight that we all need to play our part in. So please, stay at home, wear a mask if you do need to go out, practice good hygiene, stick to your bubble, and be kind to those around you. While the high numbers of people getting tested has seen some people waiting in queues, I want you to know that you are doing the right thing for yourself, your family, for your community, and for New Zealand. High compliance alongside reports of low vehicle traffic tells me that New Zealanders are following the rules that will work. And our public health units are also reporting that when they're making calls to contacts and close contacts, that there is high compliance with level 4 requirements. So thank you. Sticking together beats the virus, and together, that's exactly what we are going to do. Happy to take questions. Tova.
Thank you. How close are we to determining those one or two missing links? And do you have a working theory as to whether it was at the Jet Park or the Crown Plaza and how it might have happened?
I think everyone at the moment, is really focusing in on the Crown Plaza just as a result of timing. There's no other reason really more than that, than the timing of the onset and then some of the other cases that we're seeing. At this point in time, though, no, I don't have a working theory, but as you can see, we are chasing down every possible point at which this individual had contact with others and just seeing if we can analyse every single element of that to see if we can find where this occurred.
How much of a bearing does identifying the source precisely, how much of a bearing does that have on whether we stay in lockdown longer?
Oh, look. What we're always worried about is, yes, how far is the reach going and the spread downstream, as I talked about? But also what we're really focused on is how long was it out there before we knew about it? So this information today gives us a good, strong sense that it may not have been long. And that's really helpful information for us in making these decisions. But what about you, Dr. Bloomfield?
Yes, one of the key reasons behind, influences behind our advice to the government about the alert level change was how many undetected chains of transmission could be out here. So what seems to be a short time period between when this virus arrived on our shores, or this particular person arrived, and then the time frame between when the first person presented, and then if we go back when they became symptomatic, is reassuring. But of course the focus still now remains very much on controlling further spread of the outbreak. So it's a very important piece of information for
People should be.
I'll let you finish, then I'll come to Jane.
People should be preparing to lock down longer, though, shouldn't they?
Well, we've already given the indication to Auckland and the Coromandel around what we believe our intention will be there for level 4 over the 7-day period. So we've already gave that indication from the beginning. And you can see with the fact that inevitably we always see cases go up before they come back down. But what we always try and do, and what our public health unit were talking to us about on our briefing this morning, is just, again, putting that ring around the outbreak. The sooner we're able to do that, the higher confidence we can have. But I'll really look to give people a steer tomorrow once we've had a bit more advice and evidence. Jane?
Isn't it too late to start prioritising essential services? Shouldn't that have really been done right back at the start? Because in 2 weeks they're going to be part of the general vaccine rollout. And is this including taxi drivers, police?
Yes, it is. However, and thank you for the question, because it actually would be wrong to imply that they weren't already in that cohorting. So we already have roughly 4,000 members of our New Zealand police force who had been vaccinated. When we had limited supply, though, we started with those who were working around our managed isolation facilities, as you can understand. Supermarkets, we had several weeks ago started working with providers, employers around identifying and vaccinating that workforce. That, if I recall correctly, is over 50,000 people. So it's not a small workforce, because it's not just checkout staff, it's all those in the supply chain. But we had already started that work before this outbreak. Likewise, those who work for our fire and emergency services were also part of our priority groups. And those who work in our ambulance services, those most likely to be interacting in some of those services that still continue, we had been working through. Now we're just trying to up the pace of it now that... I'll let you finish, Jane.
Disappointing to have so many complaints, Dr. Bloomfield, of non-compliance, given the severity or potential risk of this outbreak.
Yeah, have we provided you with some of those numbers?
I gave an indication we were getting a number. I haven't got the numbers, but I do recall this time last year when we were in alert level 4 last time, there was a high level of vigilance by people on potential breaches of the protocol. So it's not unsurprising, and of course it's helpful as well, because the police can't be everywhere, and so it does rely on everybody to keep an eye on each other. But counter to that is also being helpful to each other too.
Is it your assessment that there is high higher levels of non-compliance this time?
Well, the breach notification...
No sense of that.
Yeah.
As the Prime Minister said, our public health teams are being very clear that they're getting a high degree of compliance from their sense, and certainly Commissioner Costa was saying this morning that the police are finding that people are being very compliant so far.
Yeah, so roughly 684 online breach notifications. In fact, I think actually generally when we've been verbally briefed by our officials, people are generally quite positive. But yes, we do expect, because sometimes people will be reporting, that includes when they believe an employer is operating when they shouldn't be, an individual is doing something they shouldn't. So a wide range. We can provide you the breakdown. We have it by region, by organisation, individual or employer, for instance.
Just on the question of police.
Jason.
Just on the question of police, do you find it acceptable that just 40% of all cops have been given the vaccine before this lockdown?
Again, as I explained, of course, as we were moving through, remember in the beginning of our rollout, we were having to match what supply we had with the demand we had. And we had two competing things we needed to do. Vaccinate those at risk who worked on the front line, so more likely to be in contact with COVID. And for our police, that represented those working across facilities. So 40% still, with that definition, have been vaccinated. At the same time, we needed to vaccinate those at the highest risk, which are our older people and our vulnerable people. And then we've broadened out. So we are looking to now expedite then the large number of people who are at some point possibly coming into contact with others during level 4. So 40% of the police will work on the rest, 55,000 potentially people who work across supply chains for our supermarket network.
Give us a brief overview of what it is that maybe Dr. Bloomfield can expand on what it is that Cabinet will be assessing when it meets tomorrow, when it's looking at either keeping the lockdown in place or expanding it.
Yes, all the same criteria that you would usually expect. You know, the degree to which we believe we have the ring around the outbreak. Now, remember, what we're always looking for is whether or not the positive cases that you've got coming through are from those that you're deliberately identifying as contacts and then testing, as opposed to people we have not yet identified. So that's one of the things that we look for. Whether or not you've had a time period, because at the moment, the cases that we're tracing have an infectious period across the weekend pre-lockdown. Now, the period of time you spend in lockdown reduces that, and of course that puts you in a much better position. And then the spread. We want to see a high number of testing across other parts of the country. So if you're symptomatic and you live outside of Auckland and Coromandel, we particularly want you to go and get tested. That lifts our confidence that we haven't got spread. Wastewater testing helps as well. Those are all factors. Dr. Bloomfield?
They're the main factors, Prime Minister.
Bloomfield, can you just clarify how many people right now do you know about who you're considering close or casual contacts from the cases of interest?
So I gave the number earlier on. I just have to have another look here. There was a number of 362 individuals that had been already categorised and were being followed up. But there will be, by the end of today, there will be well over 1,000 who will be contacted.
Yep. Can you just clarify on the cases of interest from 14 and 16 days ago that had people quite worried this morning?
Yep.
Are they essentially people who have reported having maybe cold-like symptoms around that period, but probably looking at the evidence MIQ, it probably wasn't COVID? Is that roughly what you're saying?
Correct. So all the CT values of all the cases that have been diagnosed are very indicative of this. These are very acute infections, and their sort of more acute symptom onset is very clear. But what the public health team did go back is they asking right back to when people might have had symptoms, probably unrelated, but they're taking a very cautious approach. So there are a couple of earlier places, one I think the earliest about the 3rd of August, that is included just to be precautionary, but we're confident that all the cases so far, all 20 in the community cluster, are very acute infections.
I'll pan around.
New Zealand has requested that the travel deadline be pushed back,
yes,
particularly to help get people back from Queenstown.
Yes.
You will need to do that.
Yes, sorry, I accept it was a lengthy report, but right in the last 2 paras of the report I referred to the fact we'd be extending for the Inter-Islander and for Air New Zealand out of Queenstown for an additional 24 hours. We will check in with them again because we have heard that there is high demand there. The issue, as you'll know, for Queenstown is because of the particular runway and airport situation there are certain pilots that have the ability to come in and out of that airport, and that does limit the number of flights they're able to bring in. But I know Air New Zealand are working very hard to lift their capacity.
What is your confidence at the moment about the outbreak being contained to Auckland?
Well, again, the higher the number of tests, the greater confidence we can have. So we'll look at those testing results and what they represent as a proportion of the population. We'll also look at whether or not we have close contacts through other parts of the country. All of that will give us a sense of whether or not we have a risk of there being spread outside those main hotspots.
No, extend the lockdown now.
I'll try and keep it orderly clear.
One to follow up anyway, so good. Is there
Yep.
any data yet on whether or not any of the close contacts are from other parts of New Zealand?
Not that I know of, but we will follow that up. The other point I just want to make
Some
is
casuals, I think.
all of the people tested at Auckland Hospital, and the tests prioritised were the close contacts of the person who worked there. All of those tests to date have come back negative, which is an encouraging sign as well.
My recollection is we might have had some casual contacts on some of those larger hospitality sites, but Claire will go and check for you.
And do you know how many people were at the locations of interest all up, basically, even based on QR things that went out?
So in their entirety for a location of interest, I mean, for instance, a very precautionary approach, you'll see that one of our locations of interest, if I recall correctly, is from the time someone reported having symptoms, but isn't necessarily within the time frame that we believe our cases were out in the community. That's our mall. And so for that location of interest, you can have a large number of people that actually may not have come within cooey of that person. And so there you can see that actually quantifying the numbers there, often very difficult. We posted it out of an abundance of caution nonetheless, but we asked people, look at the times. We don't want every single person across the day. Look at the times of interest and then just monitor the health advice.
Will those other ones be taken off the list?
We haven't, obviously it's not a decision for me, that's a public health decision, but you can see from our description that, again, it's a cautious approach.
Yes, as we gather more information, often we will refine the times and some of the places of interest, locations of interest, and they may be removed. I'd anticipate if you look at the number and the types of places, it will be many, many thousands of people. But the priority, of course, is the people who have been at those locations who are essential workers, who will still be out and about in the community. And that's why it's very important for our essential workers and their employers to keep a really close eye on those locations of interest. If they have been at any of them, they need to isolate.
Some questions.
Do we have a water bottle for you? Do you need one, Dr. Bloomfield? Okay, I'll come to you, Jo.
Following on from Claire's South Island question, is there, I guess tomorrow when you start to look at levels and how you might move, is there a particular threshold for how much testing you would like to see in areas outside of Auckland, particularly the South Island, to give you some confidence as to whether you could move particular areas out of certain levels?
Yeah, so alongside testing numbers, the contacts that we're looking at, wastewater results. For the proportion, in order to give high confidence, actually I do often hear our experts talking about the proportions they'd like. That's not a calculation I make, though. We leave that to our public health experts to make those calculations.
So often we like to try to get at least 1% of the population tested. That gives quite good coverage. But the important thing is we'd like to have as many people as possible who are symptomatic. So it's really getting... so if you look at through winter, we were probably getting somewhere between 5 and 10% of symptomatic people routinely being tested. We want to get that much closer to 100%. So that's the really critical thing.
Don't anyone calculate 1% and decide it's enough. If you're symptomatic, definitely go. Jo?
Just following on from that, in terms of the South Island, obviously they get quite critical when there aren't cases down there. Is your message to them to go and get tested and get those numbers up so that you can potentially drop them down levels if possible?
It's very important we've got that in addition to the wastewater testing, we've got good community testing. I did see reports from Christchurch yesterday that there was a high level of testing happening. That's great, but we need it right across the country.
It might be helpful to add, I did hear some queries for some smaller communities saying, please, can we have wastewater testing as well? And I heard Dr. Verrill acknowledge, actually, that what is even more important is that symptomatic people get tested, no matter where you are in the country. The lag times on wastewater, for instance, yes, it's helpful, but our primary source of information is often those testing results. So we'll just prioritise that.
On wastewater,
Jenna.
Wastewater, given that all of those 3 sites have tested in Auckland now, is there an argument to start daily testing or carry on daily testing in Auckland and further across the country because you may just pick it up?
Those are all for health and ESR, so I'll let Dr Bloomfield comment on that.
Yes, so in fact, as soon as the outbreak was identified, ESR moved to daily testing across the Auckland region, so that's already in place. And in other parts of the country, it was already on twice weekly, so we're just making sure they continue the twice weekly sampling around the rest of the country.
Do you move it up to daily across the country?
Oh, that's really I take advice from my ESR colleagues on that. At the moment, again, we haven't seen any cases elsewhere. The role of the wastewater testing is particularly helpful, just as a supplement, really, to the community nasopharyngeal swabbing. That's the most important thing.
The public way Auckland Hospital isn't, sorry, just a couple for colleagues if I can. Can you explain to the public why Auckland Hospital isn't being listed on the list of locations of interest with staff member positive there? And also, Director General, do you know whether Case B was infected before or after the weekend?
So let me take those separately.
You go for the Auckland Hospital. I'll dig through the case information on Case B.
So Auckland Hospital, we published right at the start. So it's not so much that it's alongside other locations of interest. It's a very specific setting in which there's a set of actions and protocols being put in place to reduce the risk of further infection, if there is any there, and of course to identify if any of the patients or staff are infected. So it's not equivalent to our usual locations of interest.
Case B, if I recall, was the workmate of our original case, and your question was, do we believe they were infectious across the...
After the weekend?
My recollection is that they reported symptom onset that was prior to the weekend. So I believe our infectiousness period was covering the weekend. From my memory, please let me go and clarify that, and I believe CT value would also support that. But let me check for you before I make wild assumptions. I haven't taken the questions in the front. Mark.
Dr. Bloomfield, have you seen any modelling that takes into account this possible link to MIQ about how big the outbreak might be now?
Actually, I talked about some of the early modelling from Sean Hendy yesterday. I got some updated numbers overnight from another set of modelling that was actually based on that earliest date, that 3 August date, and the median number it came up with was somewhere actually around 50, so more at the lower end of the number I gave yesterday. So that's encouraging, especially because our sense is that actually the 3 August date was probably well before the virus was here in the community, and our first person was infected in the community.
We often get a lot of disclaimers on modelling at the early stages of outbreaks of just how hard it is, so probably our modellers would want us to put that disclaimer in at this point as well. Yeah.
Are there any...
Mark.
When you, with those test results that came out of Thames Cornell yesterday, the tests that were taken, when do you expect those results to start coming?
They will be due tomorrow. Yes.
Yeah.
Testing.
Sorry, Jason, then Jane, and then Mikey.
Obviously, you were talking at the beginning that there has been a lot of testing throughout the country. Is there any plans at this stage for more surge testing pop-up stations? We've been hearing reports of a lot of people that have been turned away, specifically in Hamilton at testing centres. Some people have been told that they can't come or it's not open.
Oh, I hadn't heard that about Hamilton. I do know that there was, at the point of closing last night, there were some individuals who may have been told a centre was closing, but I haven't heard that. But Dr. Bloomfield...
There is additional... All the testing that's usually open is available, and they've put an extra workforce, and there are additional pop-up centres in Hamilton and, of course, out in the Coromandel as well.
We've had...
Is that all able to handle the influx of people that are wanting to be tested? Because these stories are coming in thick and fast.
We've had a particular conversation about some of those areas where we have large locations of interest. So, for instance, West Auckland. So that's a particular focus for the team today, is what we can do to ease some of the waits that people are experiencing in West Auckland because of those big sites of interest, particularly the high school. Mikey, I did say Jane, then Mikey, didn't I?
Are you able to give us any information at all about the positive cases since you talked about the ones yesterday, including do they have any connection to the casino, the school, some of those big groups?
I do know that 5 of them are a family group, and that they're, at first glance, there is a connection to Avondale College. That's the only one I know about, but that's all I do know. And as soon as we've got more information, because the interviews are ongoing, we will share that.
Have the teacher and then potentially another 5.
A family.
The family, and they are in the group of the new cases.
Yes,
that's right. And there was already one of our additional cases reported yesterday was already an Avondale College linked person as well.
Yep.
So are they linked to the family?
They're separate from the family. So we had 2.
The person and then another 5.
Correct.
Right.
As I understand.
Concerning in terms of the potential spread in that school. Given the nature of a school, it's a big institution.
Well,
What's happening there?
Yeah, obviously there's some experience there, and always devastating for our school communities to go through this, but right back to the beginning of our outbreak, we have had several schools that have had this experience, and so it is not unusual for us to see cases within a school community. Only recently in Papatoetoe, of course, we had cases where we didn't identify direct contact, but just cases pop up through the community. Level 4 is a good place to be, given the size of the school. Now what we want to really do is make it as easy as possible for the school community to go and get tested in their family. Just want to say to them, we are working through making that easier for you. I know some of them have been in lines as of yesterday.
Why don't we have drive-through vaccination centres set up by now? Australia's had them in operation since April, and you've received advice earlier this month. When do you expect that to be happening?
Okay, so I was just reading some reporting from our vaccination team talking about plans that in some cases were already in existence around drive-through vaccination centres. In some cases, our DHBs actually identify that in terms of efficiency, there are in some cases, sites that are large enough to actually get really good throughput safely in alternate methods. Keeping in mind, yes, it's a great way to keep people socially distanced, but you need to do things like keep up your observation periods for a large number of people over a period of time. So we let our DHBs do that assessment, what's going to deliver safely as many vaccines as possible. Some are looking at using drive-through vaccinations, but actually some have decided alternate methods will work better in this circumstance. Yeah, I did say I'd come into the front.
If you're going to extend lockdown for the remainder of the country, will you get another amnesty period for people to travel in case they decide to hunt down in a certain area of the country and then get home?
Of course, keep in mind that after that period, we do still have an exemptions process for exceptional circumstances. So that would kick back into gear to enable people who need to move.
It would be a widespread offer, basically, like it has been.
Yeah, look, my view is that last time, of course, we had a prolonged period in level 4. We managed to get people by and large moved within that 48 hours. Got a bit of flexibility around the edges where we know there's travel constraints, but really we have asked people to move as quickly as we can, and we really did mean it. But we do always have that exemption regime.
And has the Book My Vaccine website been overloaded? I mean, obviously there's extreme high demand for it. We're hearing reports that people were turning up to pharmacies having booked in on the platform, and the pharmacies or whoever doesn't have a record of them.
Oh, look, happy to follow up on those reports. As I said, yesterday we had 7,500 people accessing the site at the same time and are able to function. I do hear the odd report of people having to go back and maybe try 1 or 2 times. Look, of course we want this to be as easy as possible. We don't want anyone to be put off, but please, if that does happen to you, just pop back on again later. You can see we had record numbers able to successfully book in, so we don't think there's systemic issues, but I'm happy to take away your examples. Benedict?
You're extending the vaccination rollout to 12 to 15-year-olds.
Yes.
What would be your message to these young New Zealanders about the vaccine? But also, if they have questions or want to find out, who do they talk to, where do they go?
Yeah, actually, we've been thinking really hard about how we make sure that we're not just talking to parents about the importance of vaccinations, but we are talking to our young people as well. And so the Ministry of Health and our vaccination teams have been working on answering those questions in a really accessible way, and we'll keep working on some of those materials. But my message to parents who will need to, of course, provide consent for their children is that I would not have been a part of a process in approving this unless I believed it was safe. Because around that table, we have parents too, all affected by these decisions, and so we take them very seriously. Anything you wanted to add on that? Yeah.
Can you clarify something around masks?
Auckland has a huge homeless community. Is there a vaccination rollout plan specific for the homeless community? And if there is, has it been taken up by anyone?
So obviously you're talking just solely for vaccination as opposed to some of our level 4 readiness as well. Look, that's probably a question I best throw to Dr. Bloomfield, but at every stage we have talked about making sure that our rollout is equitable, that we are targeting everyone within an age bracket, regardless of whether or not they have a fixed abode or not. My recollection is that there was good outreach going on with our social services into those groups, but rather than me...
We're going to leave the news conference there, but you can continue watching on newshub.co.nz. A lot of new and significant information there from the Prime Minister and Dr. Ashley Bloomfield. So to recap those key points, there are 11 new Delta cases today, taking our total to 21. 12 of the cases have been formally linked to the cluster and all but one are expected to be linked. An additional separate case is an airline worker who has also tested positive. 2 of the community cases are in North Shore Hospital, one in their 20s and one in their 40s. Both are in a stable condition. The cluster has now been linked to someone who arrived from Sydney on a red zone flight on August the 7th. That person tested positive and MIQ was moved to Jet Park and ended up in Middlemore Hospital. An investigation is underway into the missing links between this case and the cluster. A family staying in a room across from the positive source case in the Crown Plaza have tested positive, and everyone in that MIQ group will now have to isolate for longer. Supermarket workers will now be eligible for vaccinations, and Cabinet has decided 12 to 15-year-olds will now be able to get vaccines. People with vaccines booked already can now take their 12 to 15-year-old with them to get jabs at the same time. The government has also extended the travel period from Queenstown and the Cook Strait Ferry by 24 hours to allow people to get home. Oreni Kaipara will be here at 4:30 with the latest, and Mike and I will be back at 6 o'clock with a full wrap of the day's developments. I'm Melissa Chan-Green. Good afternoon.